although we don't know what kind of cancer she had, we know that it is in the abdomen. We know that it was, quote, a successful surgery. So we know that whatever disease was there presumably has been optimally taken out. And that's why she's now having this chemotherapy to try to treat whatever microscopic disease has been left behind. And then from there, we'll see kind of where her journey goes and whether she decides to disclose anything further as to whether she gets placed on surveillance where they will monitor her, or whether she'll get some sort of maintenance therapy to try to prevent this cancer from coming back. We know that she has a diagnosis of cancer, even though we don't know what it is. And we know that she's getting active treatment with chemotherapy. So I don't believe that they mean that the chemotherapy itself is preventative for cancer, but rather that we're seeing that a diagnosis has been made and the treatment is being undergone. And the preventative side of things is really just kind of giving chemotherapy to prevent this cancer from coming back. A lot of the traditional chemotherapies, they are created to kind of attack the cancer cells and cause the death of those cancer cells. And as you can imagine, it can also sometimes cause an effect on the normal cells as well. Some of the most common side effects of chemotherapy include things like lowering of your blood counts, which means your immune system sometimes can take a hit, both your white blood cells as well as your red blood cells. A lot of chemos can also have effects on things like nausea and vomiting, like gastrointestinal effects.
It is surprising that whenever we hear of somebody young getting cancer, because it tends to be the disease of the old age. But recently, we have discovered that more and more cancers are being discovered earlier and earlier in life. And we think it actually is related to environmental and genetic changes that have happened over time. The wonderful thing is that now we have so many treatments for cancer that are highly effective. And using combinations of chemotherapy and small molecules and immunotherapies, even diseases that we used to think were incurable now can actually be brought back into the realm of cure. And so that's all good news. The recovery time after chemotherapy varies tremendously, but it's usually on the order of months. And for the young patient, though, they tend to recover faster for obvious reasons. And so on the one hand, we hate it when young people get cancer, but at the same time, they are the ones that recover best from the various chemotherapies and other surgeries and other therapies that we do.